Welcome, everyone, and thank you for joining today's webinar. I'm Jim Huffman with the Integrated Benefits Institute, and I'll be moderating today's discussion. I'm joined by my colleague, Carole Bonner, who led this research project and will share key findings. We're also very excited to be joined today by Dr. John Liu and Shirley Golan from Amazon. Welcome, John and Shirley, and thank you for joining us. Would you share a brief overview of your respective roles at Amazon?
Absolutely. Thank you so much for having us. Honored to be part of this conversation. I guess I'll start and pass it over to Shirley. My name's John. I'm an internal medicine physician, primary care doc. Been with Amazon about 2.5 years, and I sit on the global benefits, health, and wellness team. We're the team that brings Amazonians, which we call our employees, their medical, dental, vision, and other health-related benefits. I in particular lead population health, social drivers of health, and health equity for our global population. Shirley?
Thanks again for having us. My name is Shirley Golan, and I lead our healthcare business development efforts on the inclusive experiences and technology team. And my role primarily focuses on enhancing and improving inclusion efforts across our Amazon businesses that focus on health.
Fantastic. We're thrilled to have both of you join us today. So a couple of housekeeping items. We do have 1 hour scheduled for today's session, and we will share a copy of Carole's slides to everyone who registered for the webinar. Now, please take advantage of the Q&A feature and submit your questions. We've blocked time at the end for any questions you might have, but don't hesitate to drop a question or a comment at any time. Our topic today is belonging at work, a key driver for enhanced engagement and health. Carole's research identified the importance of belonging at work, as well as the connection between belonging and health. I'm confident that you're going to find today's discussion to be very informative and actionable. So let's get started. Carole, I'll turn it over to you.
Thank you, Jim, and welcome everybody. I am a researcher here at Integrated Benefits Institute, and I conducted this research, and I'm excited to present it today. And let me talk a little bit about the background. In today's rapidly evolving work environment, the concept of belonging has emerged as a critical factor in creating healthy and productive workplaces. However, despite its importance, belonging is often overlooked or undervalued in many organizations. One of the primary reasons belonging doesn't always get the attention it deserves is that it's inherently challenging to work with. Unlike more tangible metrics such as productivity or revenue, belonging is a subjective experience that can be difficult to pin down. So it means different things to different people. For some, it might be about feeling respected and valued. For others, it could be about having a voice in decision-making processes. This variability makes it challenging to create a one-size-fits-all definition. And so how do you measure it? And even if we can define and measure belonging, influencing it is complex. It requires a multifaceted approach that touches on things like interpersonal relationships, company and team culture, and organizational policies. So we surveyed our membership. We survey them every year. And primarily, IBI members are interested in how to facilitate and support a healthy and productive workforce. And research suggests that belonging is at the core. So we surveyed employees. We actually surveyed employers and employees, but I'm going to talk about the employee leg today. We surveyed 507 adults aged 18 to 64 who were employed. 14 were eliminated because they were self-employed. So the remaining sample was diverse, and all of that detail is in the full report. The survey aimed to provide a comprehensive understanding of experiences and perceptions from multiple perspectives within the workforce. Again, the full report can be found on our website, ibiweb.org. We segmented the population and we asked them questions about engagement and belonging. Engagement is the behavior by which people give themselves to work, and belonging is perceived social support. It's feeling comfortable and connected and like they can contribute and as if the organization is committed. So, like I said, belonging is sort of elusive. And to understand what belonging meant to the people we were surveying, we asked them to check all the boxes for those components that are important aspect of belonging. And then we bucketed them. So comfort was the first bucket. And in order for employees to be productive and engaged in their work, they need to feel comfortable and supported in their work environment. This means that they should feel valued and respected by their colleagues as well as their supervisors. They should feel safe and secure in their work environment, both physically and psychosocially. Next bucket was contribution. So that's being seen and valued. So feeling safe to share your opinions and your thoughts without fear of negative consequences, having your perspective and contributions valued by your colleagues and superiors. Connection. And connection is very important in today's workforce because we have people working in different arrangements, some remote, some hybrid, some in person. A strong sense of connection among employees is essential for building a cohesive and productive team. When employees feel connected to their colleagues, they're more likely to collaborate effectively and work toward a shared sense of purpose. And commitment. Leaders play a crucial role in creating a sense of belonging. They should model inclusive behavior and promote a culture of respect and acceptance. This involves not only words, but actions, such as recruiting and promoting employees from diverse backgrounds, providing training and development opportunities, and creating policies that support diversity and inclusion. By demonstrating a strong sense of commitment to diversity and inclusion, leaders can help create a workplace where all people feel valued and respected. In a study conducted by Deloitte Human Trend Survey 2020, they found that the connection construct and the contribution drive belonging more than comfort and commitment. And I think that's good because connection and contribution are a little more concrete. So why even worry about belonging, in the workplace? You send the employees out, tell them to get it done. But the importance of belonging in the workplace can't be overstated. It's important to employee well-being. In today's era, mental health and work-life balance are increasingly prioritized. Belonging plays a crucial role in overall employee well-being. When people feel they belong, they're more likely to feel supported and less likely to experience work-related stress and burnout, which affects health. Engagement and productivity. Employees who feel a sense of belonging are more engaged in their work. It empowers employees to contribute their unique perspectives, often leading to innovative solutions and meeting diverse customer needs. They're more likely to go above and beyond, contribute ideas, take initiative, all which drives productivity and innovation. Also, retention and attraction. In a competitive job market, creating a sense of belonging can be a powerful tool for both retaining and attracting new talent. People want to work where they feel valued and connected. Diversity and inclusion. An organization, as they strive to create more diverse and inclusive workplaces, fostering a sense of belonging is crucial. It's not enough to have diversity on paper. People from all backgrounds need to feel that they truly belong. And organizational resilience. Teams with a strong sense of belonging are more cohesive and better equipped to navigate challenges and changes, contributing to overall organizational resilience. In essence, belonging is not just a nice to have, it's a fundamental driver of individual and organizational success in the modern workplace. As we move forward in our discussion, we'll explore how we can better understand, measure, and foster this crucial element. So let's dig into the numbers. Let's talk about how employees are feeling, who feels as if they belong and who doesn't. So the vast majority of respondents, 70%, feel as if they belong. That's 44% who agree and 26% who strongly agree. A smaller percentage either disagree or strongly disagree with the notion of belonging, and 17% were sort of ambivalent. So that leaves 30% for our opportunity to improve belonging, improve health, improve productivity. So let's look at those who don't feel as if they belong. Female employees are more likely to feel as if they don't belong. Gen Z, more often, I mean, that's the highest percentage almost that we have. They don't feel as if they belong. Hispanic and other races other than white, Hispanic, African American, or Asian, and mixed races and ethnicities. People who live in the East are less likely to feel as if they don't belong. People who have adult children living at home feel like they don't belong. People who don't have anyone to care for, take care of, feel like they don't belong more often than those who do. LGBTQIA+ feel as if they don't belong more often. Disabled, and this is important, people who work hybrid are less likely to feel as if they don't belong. So the most important finding, I think, in this study was that health is associated with belonging. So healthiness was assessed, yes or no, in 3 dimensions: physically healthy, mentally healthy, socially healthy. And belonging was, or I modeled it as a bivariate scale. Yes, you feel you belong if you said strongly agree or agree. No, if you say disagree. And those who feel as if they belong are 5.2 times more likely to be socially healthy, more than 4 times more likely to be mentally healthy, and more than 3 times more likely to be physically healthy. And a data point that I don't have on this slide is those who feel as if they belong were 1.7 times more likely to be healthy in all 3 dimensions. So we also looked at engagement. And I used a scale that I standardized from a question from the engagement construct of shortened version of happiness at work scale. I standardized it across the 3 questions, and the questions are: at my job, I feel strong and vigorous. I am enthusiastic about my job. I get carried away when I am working, and this has been tested and is validated. And our average score was 198. And there was quite a bit of variability. Standard deviation was 55. So I just wanted to point that out before we go to that finding. And that finding is that engagement, belonging boosts engagement. So this is a sense of belonging, strongly disagree. As you go up a step to the next one, disagree, the engagement score is higher. As you go up to the ambivalent ones, the score is higher. Agree, still higher, and strongly agree, higher yet. And just to give you an idea in terms of grades, this is 79%, and this is 45%. So we want people on this end of the scale. So let's talk a minute about employer research source groups and affinity groups. These are groups within the company. It's voluntary, it's employee-led with an organization, and it brings together individuals who share common characteristics, experiences, or interests. And I'm going to let John and Shirley talk about that a little later. But the bottom line is these groups are important to belonging. So we had 85% of our survey respondents did not participate in ERG. And I say ERG, I mean ERG or AG. We had 15% who did do participate in an ERG. Of those who participate, none of them said that the impact from their membership in that ERG was negative, right? Some said, very small percentage, 6% said that it was neither positive nor negative. 36% said it was positive, and 48% said it was very positive. So let's look at the relationship between ERG participation and work engagement. So again, none said that it was negative, but from those who it was neither negative or positive, 10% were low engagement, 54% were middle, and high engagement was 36%. And you see, as we get more positive, the high engagement increases. Also, I modeled those who said that their ERGs had a positive effect. Their engagement scores were even more. Okay, it was 19 points more. So we're even higher if that ERG is impactful. So that gives a clear area where we can tackle this issue of belonging or not. And I want to recap. So we found this diagram sort of illustrates all of the findings and how they relate to each other. ERGs impacted both belonging and engagement. Belonging impacted engagement, and belonging impacted physical, mental, and social well-being. Physical is 3 times more likely to be physically healthy, 4 times more likely to be mentally healthy, and 5 times more likely to be socially healthy. And so the bottom line is prioritized belonging yields more engaged employees and improved outcomes. And with that, I'm going to turn it back over to Jim.
Thanks, Carole. That was fantastic. I know you had so much information in the research report, and you were able to distill it down to a couple of really important slides today and points to share with our audience. We did have one question come into the Q&A as you were going through the material. Somebody just posed this to both you and our guest from Amazon. The question is, I'm curious how both IBI and Amazon would define or describe the concept of social health. Again,
That is going to mean different things to different people. And I think the bottom line is, was the individual happy with their social health? Was the perception of that individual that they were not socially healthy? And we asked this from both the employee and the employer perspective. Those results are in the report. It's very interesting. But I wouldn't define it the same as I wouldn't define belonging. It's individual. And so we need to know what their perception is.
Maybe I'll just add from a perspective of as a physician, when I think about social health, I think about the health and well-being, health and wellness, and how it is related to community and human connection. So as we'll talk about more, I'll see if I can pull up an article and drop it in the chat.
Okay, fantastic again, Carole. Thank you for taking the audience through that. Let's now turn to Shirley and John, and we've got some questions that we'll take them through. And Shirley, I'll start with you. Carole talked about why belonging matters in today's workplace. And indeed, belonging is not just a nice to have, it's really fundamental driver of individual and organizational success in the modern workplace. As we move forward in our discussion today, as a practitioner in the space, do you find that to be true?
Yeah, I can answer this as a practitioner and also as an Amazonian employee of the company, and really in my career. So I found this to be true in my own personal experience and feel like a living example of this. So at Amazon, I feel very connected with a strong sense of purpose across my colleagues and my peers, and in particular with women. I have this longstanding passion in health tech and supporting fellow women. And as a co-founder of the Women in Healthcare at Amazon, where I serve as the Diversity Advancement Lead, and also in my role as a mentor with the AWS Cloud Women's Global Mentorship Program, I've had opportunities to support and empower women and even men who are advocates of women throughout Amazon. And these two constructs within Amazon really give me a sense of satisfaction and a sense of belonging at the company. And in my day-to-day role, I also carry this out in some of the examples I'll probably share with you later. It's a really interesting and long list of where we're very intentional about encouraging this sense of belonging.
Wonderful. Thanks for sharing that, Shirley. John, let me turn to you and ask, what was the most important or surprising finding from the report from your perspective?
Well, certainly a lot of findings. in that report, as Carole did a great job walking us through. I would say the most important finding that this report really underlined is that connection between belonging and health, and not just physical health, but also mental health and social health, like we've already discussed. And what Carole found in the work is also actually really borne out in the medical literature, so much so that this concept of inclusion and belonging is ingrained in how we should practice medicine. In fact, it's a key lever, a key pillar in the American College of Lifestyle Medicine. They have 6 pillars, and one of them is positive social connections and how they can actually impact health. And what I also like to think is that belonging has all these diverse impacts beyond just health on human beings. Studies actually show that when they look at students on a college campus, students that have a higher sense of belonging to their school, to their campus, they actually have higher rates of well-being, engagement, and academic performance, which I found really interesting because that mirrors what Carole found in the workplace as employees, right? The students feel that as well. So there's definitely something universal here. And I'd also like to highlight that the Surgeon General last year in 2023 called out that loneliness and isolation is a key public health epidemic. And that absolutely relates to this concept that we're talking about here of belonging and being included in things. So much so that let me just read a snippet from the Surgeon General's report because I think it's germane here. He notes that loneliness is far more than just a bad feeling. It harms both individual and societal health. It's associated with a greater risk of cardiovascular disease, dementia, stroke, depression, anxiety, and premature death. And the mortality impact of being socially disconnected is similar to that caused by smoking up to 15 cigarettes a day. So that's pretty darn profound, I think. And so I think that what's important about this report, many things, but one thing I would absolutely highlight, underline, bold, is this connection between inclusion, belonging, and health, and not just physical health, but all types of health.
Think about that. If you put it in those terms of 15 cigarettes a day, I mean, that's just shocking to see that comparison. Let me ask you both a question. Shirley, I'll start with you, but do you believe that companies feel there is a business case for DE&I today?
Yeah, I can certainly comment on that, and I will put my healthcare lens on in answering that. There's an article by Deloitte Insights titled "U.S. Healthcare Can't Afford Health Inequities," and the experts there called out that inequities in the U.S. healthcare system cost approximately $320 billion today and could eclipse $1 trillion in spending by 2040 if it's unaddressed. Now, calling out specifically what this means around businesses, addressing these health inequities can help business leaders, board of directors, and companies really improve health outcomes and reduce healthcare spending by addressing those drivers of health, removing the biases and inefficiencies in care, and enabling data and technology to monitor and deliver that care. In turn, this whole approach can have a positive impact on health outcomes and patient experience and quality of life, and really the greater health and well-being of their employees and all individuals.
Yeah. John, what are your thoughts on that DEI&B in the business case?
Yeah. Absolutely. I think to add to Shirley's points here, I think I bring it back to Amazon's leadership principles, which are our DNA, they're our core values and how we operate. They drive what we think about and what we do day over day. And one of the key leadership principles is that we strive to be Earth's best employer. And to me, the root of that is, of course, empowering our employees as well as helping them succeed. And as a physician, I look at that through the lens of health, of course. And so to me, it's, how can I help empower people to be as healthy as they care to be? What kind of access to tools and resources and care can I help bring to bear? And so when looked at through that lens, then I think the health of our employees is absolutely important to the business. And as we've already laid out, inclusion, belonging have very positive health impacts. And I think to make the point, I'd like to think about the opposite side of the spectrum. We sort of talked about the spectrum a little bit already, but the extreme opposite of inclusion and belonging There's a lot of opposites, but perhaps one of the key opposites is this idea of racism and discrimination and othering people. And when medical literature has found that when individuals are discriminated against or other, if you will, we experience a rise in stress hormones in our body, things like adrenaline and cortisol and other stress hormones. And these stress hormones actually have physiologic impacts on our body. They cause our blood pressure to spike, they cause our heart rate to speed up, they cause blood sugar to rise as well. And this is great in the short term, in the sense that if there's a tiger walking down our street, we want that momentary rise in heart rate and contractility and blood sugar to fuel our ability to run away and get to safety. It's that fight or flight response that we're all very well familiar with. But here's the problem. Here's the problem, that repeated chronic stressors like discrimination that happens day over day, year over year in someone's life, that leads to this wear and tear on the human body. The medical term for this is allostatic load, or weathering. People have called it weathering as well. And medical literature has linked this kind of repeated toxic stress to chronic disease. So I talked about how these stress hormones cause a spike in blood pressure and sugar. Well, think about it this way. Sustained increases in blood pressure, that causes hypertension, which is high blood pressure. High blood pressure can lead to what? It can lead to heart disease, heart attacks, stroke, kidney disease. If you have high blood pressure in pregnancy, that can lead to low birth weight babies. Sustained increases in blood sugar, that can lead to diabetes and insulin resistance and weight management issues, right? The list goes on. So all to say that when I think about this concept of DEIB, inclusion and belonging on this side of the spectrum, and really leaning into that, we have positive health impacts and engagement impacts and performance impacts. And then on the other side, where there's discrimination, racism, othering, exclusion, marginalization, we have absolute negative health impacts to the point of developing disease. So as a business, where you as an employer, right, thinking about these two sides of the spectrum, which side do you want to lean? Where should you spend your energy, and what should you foster in your culture? I think that choice is pretty clear. That's my perspective.
Fantastic. We've had a couple of questions come in through the Q&A as we've been going through. Let me just raise these and get all of your thoughts. Carole, you please as well. The question is, do you have data on the impact of connectivity on return to work from short or long-term disability and or risk safety in the workplace as seen through the workers' comp claims?
I am working on a mental health study, and some of the employers that I talked with or consultants that I talked with spoke about they see in the claims where the employee is saying, I don't want to go back because of this stressor, manager, supervisor, workload, whatever it is. And so it's difficult to get them back. I don't have solid data on that, but I would really love to do a study on that because return to work is best for everybody.
Yeah. But let me, I'll tee this one up. I think we're going to get to it a little bit later in our conversation, but the question is, what insights might we take from this report as we design new models for workplace engagement via ERGs and other mechanisms? I don't know if anyone has any thoughts now. I think we do have some conversation as we go.
Yes, I think Shirley's going to speak to ERGs a little bit.
All right, let me keep moving then. Shirley, I'll come back to you with a question. What are some of the ways that Amazon is driving diversity, equity, inclusion, and belonging?
Yeah, I'm happy to chat about that. As I mentioned in my intro, the team I sit on, it's called the Inclusive Experiences and Technology Team, or we refer to it as IXT. And what we focus on is a shared mission of creating experiences for employees, customer, and community. So there's really 3 pillars to that. So we accelerate inclusive experiences outside of the US. We have been delivering global initiatives for Indigenous, LGBTQIA, military, and people with disability communities. We're also focused on addressing the top DEI pain points for employees across America, Asia Pacific, and Europe. Secondly, we also take a holistic approach to our talent strategy to really address the most important areas across the entire employee lifecycle. And then thirdly, we make an effort to advance DEI through technology by really fostering those meaningful conversations about the growth of artificial intelligence and machine learning, and the opportunity and place where Amazon has to ensure tech products are developed with inclusivity in mind. So the goal is really of IXC is really make life easier for everyone and help everyone kind of contribute to that shared mission. So some examples, we have a number of examples that I'd like to share across the different businesses that Amazon has. First one is around devices and entertainment. Those businesses continue to build and expand accessibility features with Alexa, Fire TV, Audible, and Prime Video, so we can better support our customers with disabilities. Amazon Studios implemented an industry-first inclusion policy and playbook, which provides clear directives, guidelines, and resources to create an equitable experience for our cast, crews, and audience members. AWS, our cloud business, is building responsible AI and ML to help our customers harness its power for good and mitigate potential risks and bias against underrepresented groups. Our worldwide stores and Amazon Fashion are both bringing more underrepresented designers and sellers to our customers through collaborations on our storefronts, such as The Drop featuring Hispanic creators this month, Hispanic Heritage Month. Project Kuiper is an initiative to increase global broadband access through a constellation of over 3,200 satellites in low Earth orbit, or LEO. And its mission is to bring fast rural broadband to unserved and underserved communities around the world. In 57 countries where Amazon operates, we launched Self-ID, where legally allowed employees can voluntarily share their gender, race, ethnicity, disability status, sexual orientation, military status, and transgender status. This helps us as a company better understand their needs so we can drive more impactful programming moving forward. Recently, we earned a score of 100 on the 2023 Disability Equality Index, and we continue to score 100 in the Human Rights Campaign for our ongoing LGBTQIA+ initiatives. As of January of this year, we successfully hired 100,000 plus US military veterans and military spouses. And we have a program called Amazon Future Engineer, where we continue to make progress on our goal of helping 29 million people globally grow their tech skills by 2025. And we have 3 million students who've already been reached globally through this program, including 1.9 million in the US. Amazon made a $1.2 billion commitment toward upskilling by 2025 for 300,000 Amazonians, my fellow employees, and providing free cloud training to over 20 million people worldwide. And then lastly, through Amazon's Housing Equity Fund, we continue to provide over $2 billion to create more than 20,000 affordable homes and families in low to moderate income households. So you can see the breadth and depth of the work that's happening across Amazon.
Shirley, it's incredible. I mean, I think the reach, I think everyone knows the reach of Amazon as an organization, but how the organization has gone into the communities around the globe, and the work that you're all leading is incredible. So thank you for that, for all the work that you're doing and how you're helping with the upskilling and educating and helping people to grow with new skills and opportunities. That's incredible. John, is there anything remotely possible you could add to that?
Maybe I'll circle back to the employee resource group question, and just to add on to Shirley's points here from an internal facing lens, I suppose. At Amazon, we have 13 official affinity groups, so-called employee resource groups, Asians at Amazon, Black Employee Network, People with Disabilities, Amazon, our LGBTQ plus community, Indigenous at Amazon. The list goes on and on. And it's not just having affinity groups, but we really, as Amazon Benefits at least, we strive to work closely with our AGs in designing benefits, in listening to feedback, in working with the community to increase awareness of benefits, because that's always a growth point for all of us in this field, right? Engaging our customers, our employees. For example, when we were looking at gender affirming care benefits, when we were looking at fertility benefits, we took care to work with members of the LGBTQ plus community to understand, is this going to hit the mark? Is this meeting the mark? Is this the right approach? And we worked with our Black Employee Network, our Indigenous at and families at affinity groups, and listened to their feedback when we decided whether or not to partner with the NIH's All of Us research program. And given we have some time here, let me just spend a minute highlighting this program, because I think it integrates or it relates pretty well with inclusion and belonging at a macro scale. And the way I'll frame this up is that when it comes to medical discoveries or medical research, at least in the United States, for far too long, not all groups have been equally or equitably represented in research and clinical trials. And I would go so far as to say that at times, certain groups have even been exploited by medical research in our history, not too long ago, in fact. Examples that come to mind, Mrs. Henrietta Lacks and her HeLa cells, so to speak, and the US public health untreated syphilis study at Tuskegee. These are some major atrocities in the not too distant past. To throw some data at this, currently, I believe African Americans make up about 13% of the US population, but they represent only about 5% of clinical trial participants. And Latino and Latina Latinx individuals make up 18% of the US population, but only a single 1 percentage point of clinical trial participants. Right? So there's something off with these ratios. And what's off about it in my mind is if you're not included in medical research, if you're not included in the trials, there's absolutely no guarantee that you're going to be included in the benefits of the discoveries that result from this type of work. So it's with that in mind that we in Amazon Benefits decided to partner with the NIH, the National Institutes of Health, and their All of Us research program to really amplify awareness of this research program, encourage folks to learn more about it, and consider whether participation is right for them. A little bit about the program. It's an ambitious sort of generational research platform, really, that seeks to enroll 1 million plus individuals to learn more about their own health, but also contribute to this national platform that's really striving to accelerate population health and precision health research so that vetted researchers can actually launch multiple concurrent studies at the same time. Right? So it's really speeding up the pace of discovery and doing it in such a way that people are empowered and brought together and brought in, into this work. What I really love about the program is they've spent a lot of time earning trust with communities, including tribal nations. I've not seen this type of thoughtful work before in my travels in this field. And what I also love is they're spending a lot of time empowering participants themselves. For example, if you volunteer, then you get the results of your DNA testing sent back to you, including close to 60 hereditary disease risks, I think 59 hereditary disease risks, medication reaction risks, ancestry information, traits like do you like cilantro, fun stuff like that, and free genetic counseling to boot, right? So I'll stop rambling on this, but for folks who are interested in learning more about this program, point your web browser to joinallofus.org/Amazon. That's joinallofus.org/Amazon, or just Google the NIH's All of Us research program. I think it's something worth looking into.
Yeah, that's fascinating work. I didn't realize that was underway, and congratulations to you for getting involved, because I think you'll add so much to that, John. Carole, let me turn to you. I've been kind of asking all the questions as we go, but let me turn to you and see if you have anything to share with the group.
I just want to say, just to what John was speaking about, I'm familiar with All of Us research. We do have access to that, Jim. And I think what's beautiful about it is everybody has visibility to everybody's discoveries. So, there's only so much one person can do or one organization can do, but we have insight into what's going on. You know, an important part of feeling as if you belong is feeling seen and valued and cared for. And so in the benefit space, and we've talked a lot about benefits here, but in terms of feeling seen and valued, especially for traditionally marginalized populations, how is Amazon addressing this? Shirley, we'll go to you first.
Yeah, sounds good. Thanks, Carole. I'd like to share an example of this from one of our customers. AWS in particular works with Rush University System for Health. They are an academic healthcare system based in Chicago. And Rush serves Chicago's West Side residents who have a lower life expectancy than residents of the wealthier sections of the city. Now, Rush created a population health analytics platform. This is from a grant from the Robert Wood Johnson Foundation and support from AWS credits from the AWS Health Equity Initiative. So what Rush did was set out on a mission to build its own health equity care and analytics platform. They called it HECAP. And this is used to aggregate critical data and create a more complete patient profile for clinical and community intervention. So in addition to medical conditions and lifestyle behaviors, certain factors such as housing, transportation, access to food, these are all known as social determinants of health, help Rush Medical Center healthcare providers really understand the differences in health status. And I love this quote from their chief innovation officer. And he called it, "We have a great opportunity to bring in more data from different sources and really use the power of technology to scale massively across our system, significantly benefiting the care of our patients in Chicago." Turn it back to you, Carole. It's just moving how much Rush has done
Yes.
through the power of technology and serving their community.
All right, John, did you have anything to add?
Yeah, absolutely. I'm happy to add some context on the benefits side of the house as well. I framed this up by saying that the work is not done. We're on a humble journey to improve health equity and inclusion belonging for our employees, their families, and our communities. We don't have all the answers by any means. We're on the journey just like everyone else. But I am proud of a list of proof points that we've brought to bear and continue to put one foot in front of the other to raise the bar year over year. A few proof points, for example, we offer robust medical, dental, vision, behavioral health, pharmacy, and other health benefits starting on day one of employment because, as I like to say, illness doesn't wait 30 days. Illness doesn't wait till your first paycheck. So starting on day one of employment is really meaningful to us here at Amazon. We have an EAP program, an employee assistance program that offers 5 free behavioral health counseling sessions per issue per year. That's in addition to a whole portfolio of legal support, financial health support, life needs support as well. To get granular, we have gender affirming care coverage that, like I mentioned before, that's in accordance with the latest clinical guidelines. We have this really exciting career choice program that provides college tuition and vocational training, and as well as career advancement opportunities. We have paid family leave or paid parental leave opportunities or coverage. We have confidential treatment and support for alcohol, tobacco, opioid use, but the list goes on. And in fact, there's just today, there's some breaking news about some new benefits increases at Amazon that if folks are interested, go ahead and Google. But I'd like to zoom in on one particular piece here, which is our neighborhood health center offering. And to zoom into that just for a second, at Amazon, we have a set of 15 neighborhood health centers in 5 medically underserved areas in the country. And we work with, and they provide care to employees and their families. And from a DEIB perspective, we've been working with our neighborhood health centers for years now, but especially over the last year plus on improving and raising the bar on health equity and SDOH through a few different mechanisms. So like To zoom in on that, one, for example, is piloting mobile mammography events in different areas in the country to help meet people where they are, right? Because there's so many barriers to access sometimes. Another thing, we trained all the providers in culturally responsive care, in LGBTQ+ care competency. We've actually developed this new mechanism, which required a lot of time to build, but we developed a new mechanism to collect voluntary opt-out race, ethnicity, language, sexual orientation, gender identity data on members. And that's important because unless you have that data, then what gets measured gets managed, right? And so now we're doing that important work of utilizing that type of demographic data to stratify quality metrics. And that's important because the commercial field hasn't really caught up to Medicare, Medicaid in that regard. And so we are using those metrics to stratify quality measures to ensure that no one gets left behind, that everyone's getting high quality care and that one group doesn't get left behind in those opportunities for health. So the work continues. Of course, we're still day one, as we like to say at Amazon, still early in the journey, but we're humbly trying to make moves in the space for our people.
Awesome. I love that because you're taking it to the people. And the benefits that you have are not just for your employee, it's also for their family and their family members who perhaps just want to go down the street and have their needs met. I love that. We are getting close to the end. If you have questions, please submit them in the Q&A, and I'm going to give it back to Jim.
Thank you, Carole. This has been an incredible conversation, I think, starting with the research findings and Carole's ability to really distill down a lot of information in the report into a number of slides. So, Carole, I think great work there. Thank you for what you've done.
Thank you.
And the messages that you've helped people to hear today. And John and Shirley, thank you so much for joining and sharing not only your perspective in your day-to-day role, what you do at Amazon, but also the community that we all live and operate in. So I think that's so valuable and important to do. And thanks for sharing that with us today. Let me just remind everyone, we will be sending out a link with a recording and Carole's slides within the next few days, and you'll have an opportunity for everyone who registered to have access to that. Thank you for joining. We hope you have a good day, and we'll see you the next time.
Thank you.
Thank you.
Thank you so much. Appreciate it.